You are watching Access LaPorte County, Channel 97. Coming up next is the April 16, 2024 meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
All right, I'm calling the meeting of the LaPorte County Board of Health to order. Today is April 16th, 2024. We'll start with the roll call.
Good. Mrs. Arnold?
Present.
Dr. Dora? Dr. Uhas?
Present.
Ms. Lawn?
Here.
Dr. Meaning Cox?
Here.
Dr.
Okay.
Nelson?
Okay.
Okay. Thank you.
Yeah, thank you. We have a quorum, so we can get started. And the first item on the agenda is the approval of the minutes from our January meeting. And does anybody have any questions or comments?
One correction.
Oh, okay.
Yeah, I just wanted to note for the record that I actually appeared via Zoom at that meeting.
You did appear via Zoom?
Yes, if I recall correctly, we had a meeting scheduled and then we rescheduled it.
Yes.
Is that right? And then I had a cold and I didn't want to germ everything.
Oh, okay.
Thank you. Thank you.
Well, thank you for the correction then. And we'll make a note of that somewhere. Next item on the, do I hear a motion to accept?
I move that we accept the notes with the correction.
Okay.
A second.
All right. All in favor?
Aye.
Anyone opposed? No. So we have approval. And public comments. Do we have anybody here to provide public comments? I don't see anyone, but I will make a 3-time request in case someone walks in. Is there anyone on Zoom or anything? If not, call for public comments too. And call for public comments going, gone, the 3rd time. Okay, that's done. Health officers report.
Good evening, good afternoon, whatever it is. You know, truthfully, it is just been very quiet in a lot of ways, which is very nice. You know, all the days we've talked about the increasing number of COVID cases and that type of thing, it really hasn't been. Measles is still in the news. When I wrote this, there was 58 documented cases. Now I believe it's 110. I saw it this morning and I meant to write it down. So, you know, it has increased, but it's not significantly increased. And most of these are related to people that have been exposed to someone that came from abroad with measles. Lack of immunizations, of course, contributes to this issue. And some of this is because of vaccine aversion we all have experience with related to COVID and everything else, but also a lot of people just don't believe it's serious. They just, oh, it's measles, every kid gets measles, but nearly 1 in 3,000 children who become infected will die of either a respiratory or neurological complications. So, I mean, it is not an uncomplicated disease, and trying to get people to understand that sometimes is difficult. COVID's still here. Positive numbers with regards to this. Hospitalizations have decreased by 60%, which I think is a very positive number, and the death rates have decreased by more than 80%. It's still the 10th most common cause of death, but it's down from being the 3rd. The COVID vaccines are still helpful. There's been recent recommendations for a second one for those over 65 and with immune issues. And again, as we've talked about, common sense, hand washing, masks, early testing, symptomatic avoidance of others. Like if you've got a cold, you don't come. That was very nice. And the hope is, one of the things we just talked about, and we've talked about this in the past, so I mean, I'm kind of repeating myself, but the hope is with COVID becoming more in our background, and I don't want to ever minimize what it's done to the world, but some of the focus will go back on some of the other major illnesses, such as mental health, substance abuse, and again, there's still an epidemic of heart disease, cancer, and diabetes. The thing that has been in the news probably as much as anything right now is related to the avian influenza. the highly pathogenic one particularly, it's been reported in 2 individuals in the United States. One's Texas, and I put down Kansas, but it's actually Colorado. Sorry, that was my mistake. And then there's the low pathogenic avian influenza is in many states. The low one generally causes no signs of disease or mild symptoms in poultry, but it can, if it's in birds, they can mutate into the highly pathogenic, and that can cause severe disease in poultry and wild birds. The concern that people are having now is that it has actually spread to some cows, and that's unusual and that's new.
This on what, doctor?
It has spread to cows.
Cows?
Cows.
Okay.
Yeah. Particularly dairy, as I understand, it's the dairy cows that has been. And the problem is with that, that was in the dairy farms in Texas and Colorado, and that started just earlier this year. They've had 2 human cases, both have had absolutely minimal symptoms, and have recovered. They were isolated and treated. And you do have a handout in your, if you want to know a little bit more about it, because it is in the news a fair amount, but it actually is incredibly low risk for humans at this time. One of the things that came out in a lot of in the mail, or I'm sorry, not in the mail, the TV, that type of thing, is the concern about milk. But CDC is very clear that if you're drinking pasteurized milk, you have no concerns. If you're drinking raw milk, then it is very low chance, but it could be passed on. Mostly is low because there's not that many dairy cows that have it at this stage, hopefully at least yet not to be. But there is more information there if anybody wants to read a bit more about it, because it has been in the news.
Thank you. Are there any questions for Dr. Ducey? If not, do I hear a motion to accept her report?
So moved with the correction.
Yes, sorry, I don't know how Kansas got in there. Colorado made it in the next paragraph.
I'll second that.
Okay. All in favor?
Aye.
Anyone opposed? No. The ayes have it. Thank you, doctor.
You're welcome.
All right. Next item on the agenda. Administrator's report.
Good afternoon.
Good afternoon, Amanda.
So I kind of in my report this month, I kind of highlighted the other part of public health that we deal with, more on the environmental side, because there was some interesting stuff that came up during this first quarter. And the first being having skunk variant rabies in Indiana. You can see from the map that you have in your report that there are several different variants of rabies, and those variants are named after the primary host. In Indiana, we primarily have bat rabies. That's the dominant one. That's the only one that we really test positive for. And that one you can find across, obviously, because they're migratory animals and they fly. They can get just about everywhere. So they are found across the United States, into Canada, everywhere except Hawaii. It's even found in Puerto Rico. But for the first time in 20 years, we've seen a new variant in Indiana, which is the skunk variant. It has been here before, but 20 years ago. So that was kind of note. There's been 3 animals in 2 counties in southern Indiana that have tested positive. So obviously we don't like variants of anything to hang out together or commingle, because that creates new variants, just like it does with the flu or anything else. So, but it's also interesting that even with the bats, only less than 1% of bats in nature are infected by rabies. Even that is the most common. When people have rabies, it's typically from bat bites. The last time we had a positive case of rabies in humans was 2009. Dog variant rabies, which is still found throughout the world, was eradicated in the United States in the 70s. Correct, Dr. Dora? It was 70s? Yeah, I think 1972 was the last time, primarily through vaccination of your animals. So I thought that was interesting. And another one from a meeting that we attended, a training we attended earlier this year with IDOH vector epidemiology division, was a new tick species in the United States. This is the first time we have a new, I know, Doc, you on your hikes, you're gonna have to watch out.
They're everywhere.
Yeah, the first time a new tick species in the United States. So typically when you see a tick, they move very slow, right? They have to be on another animal to get it to where it needs to go to spread. And we've seen that with several, with the longhorn or Lone Star tick, right? This tick is a little bit scary in how fast it's moving. It was only first found in the United States in New Jersey in 2017. And in 2024, it's made it all the way to Missouri. So it's moved rapidly. And one of the reasons why is because this tick can reproduce asexually. So when the female becomes pregnant, those eggs are already fertile. And each time she lays eggs, she can lay up to 2,000 eggs. And so the number is just exponential. So you don't have to have a male and a female tick travel together and find each other in the wild to reproduce. So it spreads a lot slower. The only good thing right now is that this tick, it's called the Asian longhorn tick. So obviously it's coming from Asia. It's common in Asia and Africa. There it likes humans. Here it doesn't. So that's interesting. So far, it doesn't like humans. Right now, it's a livestock nuisance, though there are several cases where this tick there's been so many on an animal that they've killed the animal by draining it of blood. Yeah. So right now it's an economic crisis than a health crisis. But it is capable of carrying a couple of diseases like the heartland virus that is tick transmitted. It carries similar viruses in Asia. So it could possibly. So it's one to keep an eye on that they're still doing research on. And then mosquitoes. I'm just going to keep going in the, happy zone here and talk about some mosquito diseases that we're starting to see reemerge, and with local transmission of malaria in the United States. So local transmission meaning that you didn't get it from travel, that you haven't been outside of the United States, so you had to have gotten it here. So obviously somebody who has traveled has brought it in. Was sick, didn't know they were sick. The virus builds up, I'm sorry, it's not a virus, it's a parasite, gets so high in their bloodstream that when a mosquito bites them, the mosquito picks it up and it goes to the next person and takes another meal, they transmit malaria at that time. So when you do see it, you too typically see it in clusters, because mosquitoes typically most species don't, from where they hatch, travel more than a mile or two from where they hatched. But we have seen in the last couple of years, and last year, local transmission of malaria in Texas, Maryland, and Florida. And we think in Indiana that we're safe, we don't have to worry about that, but it was less than 100 years ago where Terre Haute had an outbreak of malaria with over 1,000 people affected in 1938. So at that time, it was eradicated by the 50s in the United States, probably from draining of the wetlands, and then temperature. The climate has changed a little bit. The mosquito that transmits the malaria, the Plasmodium, dies off in the winter. So if it dies off in the winter, that new hatch next year, you don't have to worry about the malaria, it's already dead, so they're not transmitting it that way. So the problem is, if the temperature doesn't get cold enough and those mosquitoes don't die off, then they can become reestablished. So that's something to watch out in the next decade or so to see how that's working out. And how many cases, are we gonna have cases this year or are we not? So, yay.
I think birds.
Science is fun. The birds, yeah, yeah. And the last thing we want is another tick-borne or a new vector in the mosquitoes. We don't want that. And I could go on about that all day long. After septics, that's my next love.
It'll stick to COVID.
You'll stick to COVID. There were several bills that were passed in this last legislative session. It was a short session this year. A couple of note, I won't go through all of them obviously, but one was House and Road Act 1258, and that's actually going towards the food code. So that's basically saying that if you have a mobile food cart, mobile food unit, on wheels with an engine, you go place to place. If somebody comes into your county with one of those, you have to inspect it and you have to permit it. That was one of those things that was always ambiguous in the code, whether you had to do it or not. So now this is saying you have to inspect them, you have to permit them. What's interesting, and we always do, we always have. What's interesting about it though, it's the first time we've ever seen in legislation where they have capped the amount of money that you can charge for a permit for a mobile unit or for essentially a restaurant on wheels. Is actually higher, the cap is higher than what we currently charge, but there are some counties that charge double than what the cap is right now, so it's going to be interesting. I can kind of see the logic behind it the more I thought about it, because they do cross county lines, and if they're paying $400 in this county, $1,000 in this county, it starts to add up after a while, where if you were a brick and mortar, you wouldn't be paying all those fees. So I don't know, we'll see how we'll have to keep an eye on that, see how it works out for the counties. We had House and Road Act 1328 about bond issuance and on-site septic inspections at time property transfers. So we know we can't do property transfer inspections anymore. People can do them voluntarily, but we can't mandate that at a point of sale. So that's why there's been changes to our property transfer proposed ordinance. And if you can't charge double bonds. So if if an installer does excavation work as well and is already bonded with the building department, health departments can't also force them to have a second bond with them. So they can have one bond to cover everything that you do in the county and not have separate bonds for separate departments. 1352, there was some clarification, a little language change about us being able to do inspections on properties with suspected septic failures. So now that it's been changed to where we can go on the property if there's an imminent health threat. So, but we have to be able to see the imminent health threat without going on the property. That's kind of hard to do sometimes.
How's that determined that it's an imminent
You smell.
health threat from a distance? Leakage?
Yeah. So if you can see it from the neighbors, if you can see it from the road,
Smell
I
it.
mean, we can't use drones. Some people have tried to do that. I don't know that forbids that, but I don't know, the council's gonna let me buy a drone to, that's where, that'd be fun though.
Yeah, it would.
Yeah, so we've had an instance in the last week or so where we could see it from the road, that we were able to that was an imminent threat, and we were able to go up to the door and knock and say, we got a problem here, we need to look at your property and we're gonna be looking at it. Otherwise, we have to send them notice through the mail 7 days advance saying, we suspect that you have a septic issue and we would like to do an inspection. And we have to give them 7 days through snail mail notice. We can't even go up to the door and knock. We have to send it through the mail. But now it's an imminent health threat, we can, if we're able to verify that somehow without going on their property, we can investigate it immediately.
That's kind of a loose term, though, because there may be a failure, but it may not be an imminent health threat.
Correct. So, right. Yeah, definition of failure in the state code is ponding on the ground.
Whatting?
Ponding.
Oh, pond, yes.
On the ground, back up into the house, or contamination of groundwater. So that one's always very hard to prove. And if you don't know what the seasonal high water table is in the area, that's very hard to prove that one. And the other one, you have to be in the house to see if it's backing into the house. Yes, ma'am.
Can you inspect via hearsay?
No.
You know,
We
say
can have-
someone, a plumber came in and saw that there was a problem.
We would have to do the 7 days written notice. Yeah. We would have to say we are receiving a complaint in our department. We're coming out in 7 days to do an inspection.
Okay.
Yeah.
7 days from when? When you send the letter?
7 days from when we send the letter.
How do you know with certainty that they received the letter?
We don't. But all it says that we have to provide proof that we sent that letter within the 7 days.
But if you have a letter, how is that proof you sent?
Can you guys speak up a little, because I can't hear?
It's perplexing, right? If you have a letter, that doesn't necessarily mean that you mailed it that same day. And how do you know when it's none of this makes a lot of sense.
No, so some of the guidance that we've been given, so we can't, of course, the state attorneys can't tell us what to do, but it's kind of what we figured what to do is that when we have the letter, when we have our own postage machine to run it through the machine, it's showing the dates that we ran it through, and taking a photo of that to say we sent this and we mailed it on this day, so 7 days from the date of this envelope.
Why not a certified letter?
That still doesn't prove because the verbiage in the state code and the new law, that bill says nothing about certified. It just says by U.S. mail.
Well, the U.S. mail has you can have it stamped and a time and date stamp. You do that to prove that you mailed something by a deadline, and you can use that. But your time machine in your office should also, that's been properly inspected and accepted and certified by the U.S. Postal Service. Then you can use that as your proof.
Yep, and it does have a date. It does show a time on it too, doesn't it? Yeah. Yeah. So yeah. The only thing too about certified mail, if you were thinking if it's an imminent health threat, people can ignore that, right? They're going to ignore that, not go pick it up. It'll get sent back to us. We have to mail it again, and that can take months. So, yeah, don't anybody tell legislation that they didn't put certified mail in there.
Okay, I got you.
We're going to work with what we got here, right? And finally, we had a intern with us for the first quarter. We don't typically have students during the actual school year. She called us looking for a project. She wanted to work with us. She's doing maternal and child health in school, and so we were able to put her with Peggy Rose, our FEMA director, our fetal infant mortality review coordinator, and she's been working with Peggy, specifically working on what is available for bereavement within the county and bereavement resources, and putting that together. No. Does anybody have any questions? Yes, doctor.
Concerning your, let's see, I think it was with the ticks. Are those ticks, have they found them in dogs? This particular tick?
I don't know that they have. They could very well be. A lot of it's the research and what I was reading. They were all talking about livestock, specifically cattle and sheep and goats.
Okay.
Yeah. But yeah, again, with this time of year, we're coming into the good weather. It's a good time to think about ticks and mosquitoes as you're spending time outside. You know, making sure that you use repellent. If you're going for a hike in the woods, to wear long pants and long sleeves. Use some kind of repellent, again, that's certified either with 20% DEET or Picardin, or what was that, IR 3535 is the other one. So check yourself after your walks if you're going into a woody or high grassy area. And definitely dusk at dawn to wear repellent when you're outside so you're not getting bitten by mosquitoes.
Yeah, they come out of the trees, parachute down inside your neck, collar.
Kamikaze.
They're resourceful.
Yes.
All right. Well, thank you. Does anybody have any more questions or comments for Amanda? If not, do I hear a motion to accept Amanda's report?
Motion to accept.
A second?
Second.
All in favor?
Aye.
Aye.
Aye. Okay, the administrator's report is accepted. Environmental Health Food Division Supervisor's Report. That's always a long one. Hi,
Good afternoon.
good afternoon.
I just want to mention something about what Amanda was saying about the registered mail, because I just sent a registered letter out on March 5th. It was not signed. It was returned to me yesterday.
Oh.
So that's how long it takes to get that registered back. But the person didn't accept it anyway. They just sent it back unsigned, nothing. So that's how that
But
works.
that would be true of any mail. If they get mail and they don't want to open it, they can,
But it was delivered. They got it in their possession, I think is the difference.
okay.
Yeah.
I get a lot of mail. I was like, I don't want to open that one. I don't open those. It's a different file.
Okay.
Just stay with it the way it is. All right.
Okay. So just some numbers from the first quarter. There were 4 environmental lead assessments that were done. And that's quite a few for one quarter for us. The water samples, there were 217 bacteria, and just keep in mind, these are the water samples that are being sent to the lab in Mishawaka still, because our lab is still down. 115 pools, 3 surface waters, 142 nitrate, 10 nitrite, 20 lead, 4 iron, and 1 copper. The tattoo inspections there were 6 done. We have 2 new tattoo establishments in the county. We had 30 environmental complaints, 7 pool inspections that were done, 59 septic permits that were issued, and 47 well permits. We do give away radon test kits in January, and we had 20 and gave them all away, so there's none left over. Amanda was talking about the new food legislation that went through. It's not going to affect us because we already do it, but the food code is being updated. The food code that we work with right now is from 2004, and we are finally getting an update that goes into effect July 8th. So that's the new food rule coming out. All the inspectors are being trained on it. We've been being trained on it once a week, once a month since January. But they are coming, the state is coming to do a full day training on it. Right now there's 450 violations in the food code and we're going to 500. So they're adding that much more to it. So we'll all be trained on that to go into effect in July. We had 15 new food establishments that opened in the quarter. 379 routine inspections were done. We did 16 temporary inspections already, and we had one establishment that was closed for non-payment of the permit for the 2024 fee. They were closed for maybe a half a day. We do have 3 of the inspectors that do complaints and septic that are being trained to do temporary food inspections currently, trying to get them ready for the temporary season before it's real busy. But they're doing great at it, so hopefully they'll be ready to go. We did have 2 establishments that were placed on probation in the first quarter. That was Kroger and El Cantorito in LaPorte. You have questions?
I just want to say congratulations on passing your exam. Your pesticide exam.
Oh, thanks.
Congratulations.
Yeah. We have another inspector that's taking that exam also. So she just hasn't finished it yet. But yeah. Thanks, Lauren.
One of the things I think we're going to see with the new food code that's going to be completely different, because we've done it this way forever. Indiana's always done it forever, and it's critical, non-critical, and repeat violations. So now it's going to be in compliance or out of compliance. It's in or out.
Yeah, it's
gonna be
called
interesting.
priority foundation and core. So that's the way it's going to be stated on the inspection sheets from now on. It won't be critical, non-critical any longer.
Yeah. So it's going to be interesting.
Yes.
But I'm glad the food
To
code is
say the
finally
least.
getting updated, because it's 20 years old.
Right.
And what year is it? Which FDA code did they go all the way up to?
22.
They did go to the 22. Good.
Are these new food establishments?
Okay.
So they have these guys that are on the sheet.
Well, unless they were opened, the middle of the end of March, they've already had their 30-day inspections. So those have already been done.
So these are going to go.
Mm-hmm. Yep. Thank you.
Thank you. Anybody want to make a motion? Thank you. Would anybody like to make a second?
I second that.
Okay, all in favor?
Aye.
Aye.
Anyone object? Nope. Food inspector report is passed. Next. Jennifer. It's our nursing supervisor's report.
Good afternoon.
Good afternoon.
Just a couple of things before my quarterly numbers. I won't go over the same things Dr. Ducey did. The CDC has updated their hepatitis C screening recommendations. They recommend all patients 18 years and older be screened and tested for hepatitis C at least once in their lifetime, except in settings where the prevalence of hepatitis C is less than 0.1%. They recommend screening for all pregnant women with every pregnancy, and patients with risk factors for hepatitis C should be tested regularly as long as that risk persists. A few numbers. As of February 16th, the percentage of the population reporting receipt of the COVID-19, flu, and RSV vaccine remains low, both for children and adults. So with the COVID-19, the updated bivalent booster, 12.4 of children got it, and 22.3% of adults received it, and 42.2 among adults age 65 and older. So those numbers aren't that great for the new bivalent booster. The percent of population reporting receipt of a flu vaccine is 50% for children, 47.6% for adults 18 and older, and 73.3% among adults 65 and older. So that's a pretty good number. The RSV vaccine, the percentage of adults 60 and older that report receiving an RSV vaccine is 21.9%, which is pretty low.
Yeah.
And then my quarterly numbers. So for our laboratory services clinic, we saw 34 clients, communicable disease 55 reports, safe sleep education 2 clients, immunizations 307 clients and 594 immunizations. For lead, we tested 1 client and followed up on 10 outside reports with 3 home visits. In our confidential services clinic, 7 clients were seen for testing and 3 HIV tests were done. All those clients were uninsured, so probably couldn't have been seen anywhere else for that, so thankfully we were available for them. TB testing, 122 tests, 113 were for work, 4 were for school, and 5 were for other reasons. And we saw 11 clients for international travel vaccines. Any questions?
No malaria. I'm not being
No malaria reported.
good. Because it is here in the United
No.
States. Just wondering.
Yeah, none from our international travel clients, no. And clients that also travel in the United States, nothing reported for malaria.
And
Thank
what
goodness.
about leprosy?
We've never had a report of that since I've been
Well, it's in the southern United States.
in a certain animal.
No, I thought
Armadillos.
yeah. Are they the carriers? But I think people have gotten it too.
From armadillos?
I don't know.
We've not had any here, so I'm not sure.
I haven't read anything about it either.
We're talking about it. Let's put it that way.
Okay. Yeah.
Okay, I was just wondering if
Yeah.
Talk about
we don't have any armadillos, so we're probably
We're probably good.
yeah, we're good to go without
Unless
leprosy.
someone gets in contact with one and comes here, I
Or
guess.
brings one home as a pet.
Right.
Okay. Pardon?
Hope it doesn't have ticks.
Right. We don't want the ticks either.
ticks on leprosy, oh
We
my.
need to put possums in our environment.
Yeah,
they
they
eat
lots
ticks.
of ticks,
Yeah.
yes.
And
Pretty
snakes.
cute.
They're resistant to rabies too.
The what?
They're resistant to rabies too.
Oh.
Yeah,
Yeah, they don't
they're
carry
amazing
rabies.
little creatures. All right. Does anybody have any questions?
Yes, okay, thanks. Yeah, I wanted to know, with these low numbers, what is the outreach from the department? Is there any sort of,
We offer
Program.
COVID vaccine at every patient visit when they come in for vaccines.
but I mean, like a program, an outreach program, maybe speaking to parent teachers, that's an old term.
Church groups?
Yeah, church groups, or is there any literature, something that needs to be at least reach their ears? They know this, they know what needs to be done, but is there an effort to get the information across?
That's a good idea. We can look into doing that. So no, we have not done that.
Maybe some of that money from the governor help.
Thank you.
Okay, so any questions for Jennifer? No? Do I hear a motion to accept her report, the nursing's?
I move
Supervisor's report.
that we accept the nursing report.
Okay. Second?
I'll second.
All in favor?
Aye.
Anyone opposed? Not at all. Perfect. Okay. Next topic is the attorney's report.
Good afternoon, folks.
Good
Okay,
afternoon.
just real briefly, we have 2 cases that are outstanding in the septic cases. Luckily, it's been a good week. I've been able to connect with the attorney for one of the cases and the property owner for the other, and it looks like we're moving these forward. We do have 2 hearings set. I don't know how much detail you want, but we've got one set for May 3rd. Thank you, Tricia. And then the other one set for July. Ideally, we will have both of these resolved before the hearing date, and we'll move this forward. But the people have been very cooperative, which is nice. Any questions?
Leave it on.
All right, thank you. I will accept a motion to accept the attorney's report. Is there a second?
I'll second that motion.
All in favor?
Aye.
Aye. No one, anyone opposed? No. Attorney report is accepted. New business fees.
So last meeting, you did give me permission to look at the fee increases for our services, and also to get it into one document. So we have one ordinance for fees and not 5 separate ones. So you can see where our current fee is on some of these, and then what the proposed fee is. I see some of them that we can't do that we already do currently and will keep. Our adult vaccines for like travel, we round up to the nearest dollar on how much the vaccine costs us plus $15. And we've done that for years, and that's kind of common practice across the counties. Same thing with our blood profile. That's to be a cash, not going through insurance to keep the prices low. So we're charging what it cost us for the test. But on the others, I did go back and I have looked at several counties, surrounding counties, and counties that are similar size to us, and also looking at the last time we had a fee increase and what the inflation rate was since then. A lot of these fees have not been updated since 2012, and inflation rate from then to now is 38%. So, I don't know if anybody has any questions or comments or concerns about any of the proposed fees. Also, some of them, the cost difference for like our inspections, how many inspections we do a year, and the cost of even our gas reimbursement has gone from like 32 cents in 2011 to now the reimbursement is 58 cents a mile. So these fees that we collect, we keep that money, it stays, and it helps to fund our programs and pay salaries. So we don't want to, obviously we're not trying to gouge anybody, but we're trying to cover our costs to continue operating.
I have questions on 3 different lines here, all in the first block. What is a paternity affidavit? What's a correction affidavit? And what's a genealogy search?
So genealogy search is an easy one. So anybody doing their family tree, give us a list of names to verify if somebody was born here or not born here. So it's really us taking our time to go through those books, and typically they're the older ones that are not going to be in the computer. So those are diving into the historical records to find that information. Paternity affidavit and correction affidavits are if a child goes home without a father on the birth certificate. If they don't do that in the hospital, they have to do a paternity affidavit. So there's legal work involved there to add their name to a birth certificate. And a correction affidavit would be if it was like an adoption or a spelling of a name, or again, adding of a parent and taking of a parent off if there was a legal adoption involved. Yeah.
Okay, so that's spelling of a name for the correction affidavit.
typically we'll do that if it's the spelling, if it's illegal, if it requires a legal adoption to change a legal document, excuse me, to change the spelling of a name, then that's more involved. But if it's, yeah, we can't just change the name or the spelling, whatever it is, unless they go through that correction. Yeah. We can't change a name on a birth certificate unless they've gone, even if it's just the spelling of a name, unless they have legal documentation to do that. Yeah.
Yeah, that's my problem.
Yeah.
One thing I wanted to ask about was the shingrix. And I wanted to know, do you have any statistics on the prevalence of shingrix in this population? And the reason why I'm asking about the cost is because of the fact that just recently Medicare has approved, so it's pretty much free for most people over 60 or 65. And but it's very expensive, and it precluded a lot of people, me including, from getting the shingrix because it's so expensive and you need two of them. So I was just wondering about this because I've met people who said that they had shingles and just how debilitating it was.
Yes.
And I'm quite sure that that's a lot of man hours from, if they're working from their job. So to encourage, is there any way we can do to encourage more people to get shingrix and maybe due to some sort of funding in order to reduce the cost for those who are at greater risk? I'm not just saying anybody, but those who are at greater risk for getting shingles.
We can definitely look into that. And it is an expensive vaccine, and you do have to have the 2 shots, and a lot of insurances were not paying for it. And obviously we don't take private insurance. So that price there is the cash price. But starting next month, we will be starting to accept private insurance. So that's gonna,
They don't pay for it.
Medicaid doesn't, or
No, private like Medicare.
we'll be able to do Medicare, Medicaid, and private insurance.
But I'm talking about the private insurance for those who are still working, who are at risk for shingles. They're the ones that can't.
My insurance paid for it without any problem.
Insurance pays for it.
Oh, county insurance pays
Yeah.
for it, right on.
I don't know that all do, but there are certainly multiple places that, organizations that do cover it.
Okay, well, maybe that's something kind of new. Okay,
I'm old. I had mine done when it first came out, so
That's good.
so it was a while ago.
Okay,
Guillain-Barré,
right.
the vaccine.
The
Yeah,
Guillain-Barré syndrome. Yeah,
It's so rare compared to how people really do suffer from shingles. Oh my gosh.
Yeah, I was one of those people last year, so it was
That's right.
just before. I mean, and I'm not of the typical age
Right.
yet, so I mean, I wasn't even eligible to get a
Right.
vaccination. But it was in my lung, and I felt every breath I took felt like a cigarette was in my lung. It was awful.
It really is terrible, or can be. Not everybody. You know what? It can be just awful.
That was shingles
It was shingles
in the lungs.
in the lungs.
I've heard of it in the eyes, but
Yes, that can cause blindness permanently.
yeah. Well,
I didn't know
the fact is that people that get shingles on their skin, the cutaneous, is awful. Thank God I have not had it, but patients that have had it and would come in and they didn't know what they had, and they'd say, I have back pain going down my leg, and I go, well, we'll take a look at you, and then I'd take a look at their skin, and it was really the shingles. So it's not fun to get, and if you can afford it, I think it's probably a reasonable vaccine if you're not averse to vaccines.
I obviously would recommend it to anybody that can get it. For the years and because again, there's also what's called post-herpetic neuralgia, is that even if the shingles, the rash is gone, people can suffer from it for the rest of their life. So, or certainly for years and years and years. And I found a fair amount of resistance in my practice when I was doing family practice to getting it done. And it wasn't necessarily money, it's just, oh, I don't need it. You know? It was just something people didn't know enough about, I think, even despite the fact there's a lot of advertising on TV, but it seemed to be something that it just didn't seem important to so many people until they got shingles.
They have a good ad on TV about Shingrix, that 90% of the people over 65 have the virus. But I'm curious about what percentages of the people over 65 that have the virus actually get shingles.
Well, I'm sure it's out there in some number, but I couldn't quote it to you at
Yeah,
this point.
I'd have to look it up.
Certainly when I was in practice, I saw a lot of shingles, and I don't know
Really?
what percentage, but it was not an uncommon diagnosis.
Yeah, no, that's true.
How many people that say the Shingrix still get it as opposed to with the old vaccine before Shingrix? I know.
I can't quote you that. I know that one of the things that they do say that if you're unlucky enough to get it, you have much less symptomatology and much less chance of getting post-herpetic neuralgia. But I couldn't quote your number right now.
Yeah, my dad had the old vaccine and he had it horrible down his back and he suffered. And but he told me to get the vaccine because he said I didn't want to get it, but it didn't help him.
Well, you know what? I wish everything worked for everybody. Wouldn't that be wonderful?
Yeah.
Yeah.
No, but that is definitely something we can look into, especially with our Health First Indiana funds. There's, if we can think it, we should be able to do it. So it's going to take several years for a lot of those programs to get up and running, but that's definitely one we want to be able to use that money to give back and put into the community. And if we're able to do that, even now with us being able to accept all the insurances, that's going to be able to allow us to reach a lot of population.
Yes.
Public service announcements. Yep. Yeah.
Okay.
Thank you.
Did we get a vote on that?
No, not yet. So moved.
What are we voting on? Are we voting on, this is the.
If you're
the-
comfortable
the
with the proposed fees.
I move or second the change in fees.
So everybody agrees. Is there a second to change the fees?
Yeah.
That was.
Yes, okay. You're a second. All right, all in favor of changing the fees as proposed? Say aye.
Aye.
Anyone opposed? The ayes have it. All right. On-site sewage systems ordinance. We kind of talked about this.
I know you guys are everybody's tired of hearing about septics and all of that.
Oh, no.
I'm sorry.
My first favorite thing.
Your first, that's I know it's your second, but it's my first. So I did hand out an updated. I had submitted this to both, Laura has gone through it, and I had submitted it downstate for them to review, for Alice Quinn to review. There were a few things that I did take out, because I didn't think it would get through, and I could probably defend it, but I don't think that it would still pass, because remember, there's 9 different people with 9 different thoughts and ideas on the panel. The copy you have here is highlighted in all the wonderful colors. So the yellow sections is what came back from the state as those are all good. So yellow is good. The green sections are areas that I'm going to have to defend. So, and I think I'll be able to. I think I have a good argument for each one of those points, especially on the comments. The very first one that's highlighted in green is the definition of an inspector, and that's not really kind of anything that's identified by the state or in the state code. However, there are several pieces of legislation that talk about inspectors, and we have this whole certificate program from the Indiana On-Site Wastewater Professionals Association that certified people to be qualified inspectors, being able to go in and evaluate a system without being an installer. So if we're going to register the installers, I think we should still be able to register the inspectors if they're allowed by legislation to inspect and evaluate systems. We should be able to provide a list to our the residents of the county to saying, here is the list of people in this county who have passed this certification through this third party to say that they are qualified and they know what they're looking at when they look at your system to evaluate it for you, and not just somebody's brother down the street who kind of knows what he's doing. So I'm pretty sure I can defend that one, especially since it's in other areas of legislation where it's brought up. Same thing with in the green, in the another one, the fuchsia one was another one was green. I changed it to fuchsia because this is another one where, yes, the TRP hasn't approved that, but it's another piece of Indiana code. Indiana code right now says may charge an issue an operating permit and may charge a fee, and we're saying over here in the ordinance is saying that we are going to charge an operating permit for these specific systems. So I don't know why why the TRP wouldn't allow that to go through. So that's why you got the kind of try to color code it where all the yellow sections are good. The state says there's not going to be any problem. TRP, we've already reviewed those sections and we're happy with them. Again, we've only passed one ordinance. The TRP has only reviewed and passed one ordinance. So as we start to see more ordinances and pass them, there's other things that are going to go through easier. So next week we have a meeting and still we only have one ordinance. But like a lot of health departments, they only meet quarterly. So a lot of them this month, April, are at their health board saying, can we move forward with this? I think we're going to get inundated in February and June with ordinances. I hope so, because I know people, they need to have them in place. I might have taken a side street on that one, but so those are my thoughts. The green areas I'm going to have to write up and make a good argument and present that to the TRP as to why I think we need to have that in our county. And I apologize for not having this one to you sooner. I did just get it back from the state with their comments. So really nothing has changed from the last time other than letting you know what I'm going to have to defend in front of that panel. And then there's a risk of them not approving that. And are we okay with that?
In page 4 of 12 on the new handout, the green, dark green, section
Yes,
3, an inspector must register with the LaPorte County Health Department if they want to inspect or evaluate existing residential and commercial on-site sewage systems in LaPorte, Indiana. Registration requires the following. That's something you have to defend?
Yes.
But
because it's not in the state rule right now.
so if somebody wanted to hire an inspector right now, at this point, there is no way for them to know who is
No.
trained and
Correct.
registered, and it's kind of scary. Are people allowed to have their repair person, let's just stay with, I'm not doing installing because that's new building, but are people allowed to have their repair guy also qualify as an inspector for your purposes in the health department? Could it be one and the same person?
It could. There are some that carry both certifications through
And
IOPA.
it's accepted, it's not, doesn't need to be more arm's length than that?
No.
Okay. All right.
Yeah. Essentially, all installers are inspectors, but not all inspectors are installers.
Right,
Yeah.
right. That's why I was thinking, if you've got an installer or a repair person, then they could probably also inspect it on their way out the door.
They would be able to evaluate the system for for certain purposes.
Okay, it's good to know. Anybody have any questions? Anything else on this?
No, ma'am.
Okay. I'll entertain a motion to accept the changes to the on-site sewage systems ordinance as discussed by Amanda.
I vote for it.
What?
Mine doesn't count.
Okay. Is there a second?
I'll second that.
All right. All in favor?
Aye.
Aye. Anyone opposed? No. Okay, next. Moving on to property transfer ordinance.
Correct. So, obviously, we can no longer, under legislation, require an inspection for septic systems. However, that doesn't have any effect on our drinking water wells. So we would still like to have that in place at the time of inspection to have the drinking water well inspected. So remember, if you're out in the county or even in some areas of town, you could be on your own private drinking water, and that is your own responsibility to test and maintain, to know you're responsible for the quality of the water that you're drinking. So you need to know what it is that you're using. If you're living in the city, you don't have to worry about that. Your water is tested daily. Every day there's a water test that's done by the water department. And if you didn't know it, LaPorte is on wells. They have several wells throughout the city that they pull water from to provide water for the city. And obviously, if you're in Michigan City or in that water plane, that it comes from Lake Michigan. But again, it's all tested daily for safety, quality, contamination. So we were thinking that that's a good time to try and catch that. A lot of people don't test their water wells. Some do it religiously every year, others don't. But at the time of inspection for a family coming and moving in to a home, to be aware of what the quality of their water and the safety of the water at that time.
Wasn't the sticking point here the last time we did a microphone? Thank you. Wasn't the sticking point the last time that Mr. Presley thought, or Pressel thought, that it's on the homeowner in the rural area with wells to test their water and not for the government to mandate it or pay for it? Or,
He doesn't, right, he doesn't think anybody should be mandating anything.
right.
Correct. Right. So, but
That was the difference between.
Mm-hmm.
Okay. So this is a little bit different. This applies to people with wells.
Right. So that's still his big sticky point is about the septic systems, not mandating a septic system. He doesn't. At least the last time I spoke to him, he doesn't have a problem with the drinking water.
Oh, okay. So this wasn't. So it was the septics.
Yes.
Gotcha. All right. So the change here is that for property transfer ordinance, somebody has to pay for water testing?
Right, and a lot of the loans do. If you're getting a VA loan, they make you test for a million different things and have a bunch of different inspections. And some of the lenders will require it also. They're also real big about the separation distance between a well and a septic system. But really, this is still just our property transfer ordinance that was in effect last year, minus anything remotely associated with septic systems.
Anything else on this? Does anybody have any questions about this?
Please forgive me. Quickly.
Yes, ma'am.
Has anyone done a survey of people, well, I know it's everybody's right and freedom in the United States, but has anyone done a survey on those who have on well water that's not inspected? Has someone, is there somewhere where they can get that information, or that information is put out there? Because if you don't know, you don't know.
About water.
Safety, you know, the fact that they need to test.
Right, we do put that out there. Every year, May is not National Drinking Water Week. During that week, we do a big push.
Right.
We also typically buy and distribute free at-home test kits. So they're not certified kits. But it's kind of, it gives you an idea, it tests for a bunch of different things, to give you an idea if you may or may not have a problem and if you should get further testing. So we do big education at that time. But yeah, we do have stuff on our webpage. We will be getting a new webpage here in the next month or so also. That's exciting. But that's next quarter. Yeah, and the state does as well. So yeah.
Thank you.
Yeah. And there are other counties that have an ordinance similar to this. They call it, instead of their property transfer, it's still at the time of transfer, but it's called wellhead protection. Just so you know that's not unique to us. If that makes anybody feel better.
When is the well water awareness week? You say it's in May.
It's typically the first full week of May. And hopefully we're able to do that this year. We won't be back in in our water lab, unfortunately, but we'll be able to get some of those test kits.
Is the community that has wells receptive to testing, the idea of testing?
They are. I mean, there's some people you're never gonna, I was gonna say, you can take a horse to water, but you can't make them drink. You can tell them, same thing with vaccinations, you know, some people are happy not to know. But then, like I said, other people are very open to it, very receptive to it. We are the only laboratory in the county. So I think that's a good thing. I think that makes a huge difference. If we didn't have a lab, I think there are a lot of people who wouldn't bother testing and they would never know what it is that they have. And we do have positive cases of, we do see a lot of coliform bacteria in wells, and that's not uncommon, especially in new wells. After they've been drilled for the first several years, to see that to reoccurring until everything kind of settles. So that makes you having to shock the well or chlorinate the well once a year until that all settles out.
No idea.
Yeah. E. coli, we do get some E. coli's every now and then, which is always interesting.
Yeah, that's a bad one, actually.
Yeah, so it's like, do a retest and see if that really was a positive, or did you not clean did you not clean it well enough before you opened the bottle lid? Yeah, that's a whole nother issue. But then trying to figure out if you did take it properly, the second test comes back okay, where is that coming from? You know, do you have a contamination from a failed septic system or something else going on? We do get high nitrates, and that's something that could kill you. So that's, there is stuff in our water that if you don't know about can cause adverse health effects. We can't test for everything. If you see coliform, sometimes that's an indicator species. And if we can get rid of that, that's going to get rid of basically the bacteria with the chlorination. But when you start seeing the chemistries, it's difficult to get that without doing a reverse osmosis.
Okay. Does anybody have any further questions?
I do. Do the test kits have a shelf life?
They do. They do have an expiration on them.
Oh.
Yeah. The ones that we purchased do. Yeah.
Any other questions for Amanda? Otherwise, I will entertain a motion to accept this discussion about property transfer ordinance.
I move we accept new business as discussed.
Is there a second?
Second.
All in favor?
Aye.
I
I do have a little something. I apologize. What's going on upstairs with the renovation? Should I not ask?
We're really close. We're really
Okay.
close. Yeah.
So you're not there yet?
We're not there yet.
Because I see your little office here is closed right now.
Oh, I closed the door so you can't see our mess.
Oh.
Yeah, we're getting really darn close.
Okay.
So I don't want to say a date because I'll just jinx it at this point. But you know, after 16 months, we're ready to move back.
Yeah, I bet.
We all are. We're tired of looking at each other, sitting on top of each other. Yeah.
Yeah. Okay. Good luck.
Like,
No
yeah.
fist fights. All right. Jules, do you have a calendar template like you usually bring for me?
The next meeting date. Next meeting date has already been established.
Oh, okay.
So y'all selected July 16th for the next meeting date.
Oh, okay.
That was at the last meeting.
Oh, okay.
You
Thank you. No, I
you booked ahead.
you did it for the year, is that correct?
Yes.
Wait, what?
Everyone.
For every, yeah, okay.
Yes, so
Thank
it's
you for the reminder.
You're welcome. So you're looking at Tuesday, July 16th at 4 p.m.
All right,
Okay.
I got it.
All right.
Well, we were ahead of things then. All right, is there anything else anybody would like to bring up? If not, I will entertain a motion to adjourn.
So moved.
Second?
Second.
All in favor?
Aye.
Aye. Adjourned.